Afternoon guys, Happy New Year to you all. I know it's a bit late in the month to be saying that still, but this is my first video of 2014, so it's important for me to begin it with that message. I know January can be a hideous month for many of you out there, myself included, but we're nearly there, 8 days to go, and I hope that it's proven to be as easy as it possibly could have been. Spring is coming. The weather will hopefully begin to improve. Not promising right now, but keep going. We're nearly there. So I want to begin this first video of 2014 by firstly wishing you guys well and thanking you for watching me still. I have been asked in the past couple of weeks why I still make these videos, why I still am so vocal about my poor mental health, why I don't hide it, why I insist on making it a thing. Those questions have been asked to me with a negative slant, negative angle, I believe, and I want to use this opportunity to respond to those people. I insist on doing this still because the level of stigma attached to poor mental health is still way higher than it should be. The fact that it still exists, period, is awful. I, as some of you may know, graduated uni last summer, and it's become higher on my agenda now to find a career job, to find my place in the employment market, and I still believe that my poor mental health will hamper me in getting a job. I still believe that some employers will use it as a reason not to hire me, and I am certain that across the country there are still people who are capable, can do the job, but are not being employed purely because of the admittance of their poor mental health or history of mental health issues. So that's one reason why I do this, because the more we talk, the more we can begin to align poor mental health with poor physical health. Secondly, the lack of understanding over what it means to be depressed like me, or to have bipolar, or to have a drug and alcohol addiction, is still rife. People do not fully understand what it means to live with a mental health illness. This has been proven in the past 3 or 4 months to me. Firstly, Halloween just gone, multiple leading supermarket chains insisted on selling Halloween costumes in the style of mental patients. Luckily they're withdrawn, and luckily the backlash from the public was justifiably high, and perseverance by people on social networking sites in the media to get those costumes withdrawn proved to be successful, thankfully. But we're still in a world where people being treated for mental health issues are still seen as freaks or weird or something to be feared. So I make these videos to show that Nathan, who has anxiety issues, suffers from depression, is still human, is still, I'd like to think, approachable, can still talk quite coherently on matters with this subject or with something completely separate from my mental health, are not defined by this one issue. It's not something to be scared of. And it just proved to me that the level of antipathy towards mental health still vastly outweighs that against physical health. For example, we would never dream of going to a shop and seeing a costume of a cancer patient. We would never dream of seeing an image of someone on a rigorous course of chemotherapy, thinning hair, dramatic weight loss, being the poster person for freaks or something to be scared of. We would never, that is unthinkable. So why is it okay to have someone in a straitjacket in the extreme, or someone with that badge, mental or insane? Why is that commercialised, and why is that still seen as scary? Similarly, just in the past couple of weeks, Urban Outfitters advertised clothes on the website, two of which came to immediately resonate with me. One t-shirt had the catchphrase, "Misery loves alcohol," and the other one that I noticed just had depression written on the material. Again, we would never see a t-shirt with cancer written on it as a fashion statement. Addiction is a disease, it's an illness. To publicly walk around with garments that use people's struggles and people's illnesses on as something of a fashion statement, it is disgusting. Luckily, I need to say, those t-shirts and tops have been withdrawn again. Urban Outfitters did act relatively quickly on this issue, although their apology wasn't as satisfactory as I would have liked to have seen, but they've been withdrawn, and again, thanks to support from people on Twitter and across the news media, they were taken off sale. But that's just a couple of reasons why I still publicly say I have depression, why I will still keep tweeting and Facebooking about my mental health and sharing articles and trying to tell people about what it really does mean to live with this condition. Because there's clearly, in 2014, still a lot of work to be done. So I make no apology for doing this, and I will continue to talk about this subject as fervently as possible. So, as we are approaching the end of the first month of 2014, I thought it would be a good opportunity for me to let you guys know about some of the plans that I want to put into place this year. I want to do more of this public declaration of my mental health, and I want to tell you a little bit about how my month has been so far. As with many, as I said earlier, January is a hideous month for most people with depression. That transition between old and new, that's starting again, the hideous weather, the dark mornings, dark nights, all works in unison to not make these early months of the year overly inviting. So I've not had the best couple of weeks mentally. Things are becoming a struggle, and it became apparent to me that I wasn't as well as I should or could be. So yesterday I went to my GP, and people who know me realise how much of a big deal that was. That waiting room, as I'm sure many of you know, that time waiting to be called in to see your doctor is hideous, and that feeling I wouldn't wish on anyone. That tight chest, that churning stomach, that heart pounding, horrible. So I thought I should give you some advice on how to deal with that appointment, how to deal with that 10-minute session with a GP. A lot of people who I've spoken to with a similar condition to myself say that you should write down thoughts, feelings, because in that one-on-one environment it can be quite daunting and you can forget things, and I personally put on a big front to get out of the room as fast as I possibly can, which in retrospect is the worst thing I possibly do, because the time taken to build up to it, I wasted the opportunity. So yesterday I wrote feelings down, what I wanted my GP to know, and I'll read it to you now actually. I'll give you a quick sense of what I gave to him. I put, I have to work myself up to do even simple things. My mood is worse in the mornings than at night. Feeling of dread and hopelessness when I wake up. Recently been waking wishing I died in my sleep. Not every day, but it's becoming more frequent. Despondency and lethargy, sleeping too much. Sometimes overly anxious. I'm getting irritable and overly stressed again. Sometimes too emotional and irrational. Becoming hard to find pleasure in things, and I'm growing increasingly reliant on people for reassurance and validation. Self-esteem is decreasing. Nearly no hope of the future. Everything seems that bit too daunting. I need to succeed, and I really don't think I will in this state. My motivation has declined again. No real tangible aspirations. Accomplishing things is difficult and takes more energy than it should. So I gave that to him, not perfectly worded, not in any way any great masterpiece, but that's all he needed. And I came out of there assured that he would fully know how I was. Subsequently, my medication was doubled, and we are now discussing various forms of psychotherapy to see which one might work best for me. So that is one piece of advice that hopefully may help any of you out there who are struggling to make that first step in going to a GP. Just write it down. Doctors see people with anxiety issues, with depression, with addiction, with anything that's not tangible, not physical every day. They will not judge you. They have heard it before and have probably heard much worse before. It takes a lot to be honest, but once you are able to be honest, I am hopefully proof that things do start to get set in motion, and there is hope out there if you know how to get it. So perseverance, honesty, and that doctor's appointment is not pleasant, but you've come through worse. You've lived for possibly weeks, months, years with this indescribable pain, struggle, darkness. 10 minutes and chances are it will begin to get better and easier. Yeah, try today, make the phone call. It will help, it really will help. Okay, so I wanted to close this first video of this year by giving you guys some sort of idea of what I hope to achieve this year where this practice is concerned. I have really started to put more energy into researching mental health and planning how I can personally do my little bit to help reduce stigma and to make mental health and everything that comprises, be it addiction, be it compulsion, anything that comes under that umbrella term of mental illness. Less of a taboo and more of an acceptable and actually more of a believed term. Still people don't believe in mental health, poor mental health, because you can't see it. Still people think I use my depression as an excuse. If I'm late to work or if I can't make work, it's not because I'm lazy, it's not because I get bothered, it's because I physically cannot. So, with that in mind, I am, as I said, researching more, planning more, and I have got some ideas for future videos. So I'm going to really take this seriously and really try to focus a good amount of my attention on helping hopefully at least one person out there watching this now, as well as helping myself. This is my outlet, I suppose, in conjunction with medication and hobbies. I mean, I've started doing photography, I've started walking more, and I'm learning to be more in tune with my mind and my body. Now, I admit that does sound very abstract, it does sound a bit airy-fairy, but through this and through meeting people with similar issues to mine, I am learning that there is not one quick fix. Firstly, medication is not some magic pill that will make everything be okay. Medication gets you to a point where you can begin to deal with things again. Medication, its primary aim is to get you to a point in your thought processes and your mental state where you can begin to think, actually, you know what, I now want to get help, I want to talk. So I'm a strong advocate of antidepressants and medication when they're used correctly and when they are used in conjunction with talking therapies and lifestyle changes. I'm no expert in diet or healthy eating, but things we put into our body do affect our mind, I know that for sure. So learning to listen to yourself is important, and letting yourself be helped, but be under no illusions. That cliched road to recovery is a hard one, but there's so many positives on the way which you can reap from it. I've met some fantastic friends through doing this sort of thing. I've cemented my existing friendships. My creativity is, I think, heightened. the small things in life I'm learning to take pleasure in again. Slowly, very slowly. And I'm by no means well recovered. I will have this condition for life, I believe. But right now, I think I can live with that. So, I'll speak to you all very soon. Hope this has helped someone to a degree. I will speak to you very soon, and I will get planning on more researched and helpful videos for us both, and hopefully this year will be the easiest yet. Hopefully. Take care, guys. I'll speak to you soon.